Welcome to 160 Studios. I'm Holly Scott. In November of 2023, the Biden administration launched the White House Initiative for Women's Health Research. Subsequently, in March of 2024, they signed a White House Advancing Research and Innovation Forum, and that has now created opportunities for additional funding into research. I met with this fine panel about a year ago, and we discussed this initiative and the excitement around it. And now here we are, a year plus later. We have a new administration, and impact is to be discovered on both women's health as well as the medtech industry at large. So I'm pleased to have with me today to discuss this Liz Powell. She is the founder of G2G Consulting and the co-founder of Women's Health Advocates. I have Marissa Fayer, the CEO of Deep Look Medical, as well as Her Health EQ. I have Neda Hanafi, the founder of MedTech Strategy Advisors, the co-founder and board director of MedTech Color, as well as the co-founder of Women's Health Advocates. And then lastly, I have Amanda De Palma, the Senior VP of Marketing and Communications for Ultrasound at Siemens Health and Ears, also on the board of MedTech Women. Thank you, ladies, for joining today. So let's get started. Big question, and I'm going to start with Liz. Liz, tell us a little bit about where we have been in the last year plus since the Biden administration initiated this effort.
Great. Thank you so much. It's so nice to be here. So I think that it's been obviously a bit of a roller coaster ride. So there was a lot of excitement with the launch of the White House Initiative on Women's Health Research. There were a lot of events and convenings, and just elevating the issue of women's health has been tremendous. There's been a lot of private sector response, increased investment, increased awareness, and even just more, whether scientists, CEOs, VCs, attention to sex differences as they're evaluating whether they want to invest in an innovation, for example. So a lot of great things. On the government side, there are some 20 plus different directives that came out of the Biden executive order on this new initiative, and they have not been reversed in the new administration. So there's lots of activity still happening within the different agencies across government. There's still coordination going on, and there's still activity. On the other side of things that I think have proven very challenging are these new executive orders. There's, as of today, 73 executive orders, a bunch of memos, other directives, so well over 100 at this point. And obviously, diversity, equity, inclusion ban has been included in that, and all of the different agencies have been scrubbing for words that reference that at all. And so that has been very frustrating. They've also done They tried to pull back on all grants, and then a court stepped in and stopped that. So at least grants are proceeding. But there's been firings. There's the huge layoffs that's happening right now as part of the DOGE effort to make government more efficient. So I think it's been a rocky road the past few weeks to figure out what's really happening. And then out of the blue, there was the IVF executive order that just came out a couple of days ago. So it's a rocky road. It's sort of all over the place. And it's interesting because we're seeing pockets of clear frustration, like this is definitely blocking our ability to advance women's health. And yet other areas where it's like, oh, full steam ahead, let's keep going. So I think there's a lot to navigate and figure out. And so I'm really glad that you brought us all back together again.
Thanks for that. And you're certainly close to the action on it. It was my understanding that many of the beneficiaries from the initial 113 million that were deployed across those 23 projects, so to speak, covered specific clinical areas like endometriosis and Alzheimer's, dementia, cancer, cardiology, areas that may disproportionately affect women or affect them in a different way. And those, to your knowledge, have not been affected at this point. They are still moving forward?
Yes. So that's the Sprint for Women's Health program and ARPA-H, and those are still full steam ahead. The funds have been already distributed as it's a reimbursement system, but they've already been distributing those funds. They continue to do that, and so those programs will continue.
Excellent. When we think about the DEI initiative, what first jumps to mind, and this is my medtech reflex, is the impact on clinical trials, because I know that a lot of the reason that we were excited about this effort was the specific trial recruitment and the focus on impact of disorders specifically to women. Neda, maybe you could share with us a bit about this. What are you hearing, seeing from those involved with clinical trials, and are there concerns about having adequate representation across women and women's health overall?
So we know that historically women have been underrepresented in clinical studies, and that women of childbearing potential, pregnant women are kind of standalone exclusion criteria in clinical study protocols. But I don't think anyone is stepping away from making sure that their clinical studies actually include and represent the patients that they're creating their devices or products to treat, right? You have to have representation. So in actual fact, I think the companies are gearing up to do the right thing. Many of them have been doing the right thing. I think the diversity action plan, that guidance that was put forward by the agency across all centers, was just another way to formalize what FDA is going to be looking for when you submit your clinical protocol. You need to give them a plan to say how you're going to enroll the reflective patient population. And it's not just about enrollment, it's about retention as well. So I think what I'm hearing and what I'm seeing, and I'm hopeful our other panelists can speak to this, is that people want to do good science. It's about developing products that are meaningful and actually work in your intended patient population. And if we dig deep into how that actually aligns with regulations, it goes back to your intended use and your indications for use, your patient population, the disease area. And that's why we need to have studies that are developed with the right patient population included in those studies, and how you engage and reach out to these communities and ensure that you enroll them, ensure that they are retained in the studies is part of the process. And it's a science and an art. And we actually see a lot of progress going forward. And I don't think it's one administration to say it's wrong, because these scientists have been living and breathing this for decades. And we know the value of collecting meaningful scientific data. So more power to all of us to do the right thing. Good science, doing good science.
I want to just comment as well. I was just reading another article this morning. And listen, we could, nothing prevents anybody from including everybody in, specifically in these clinical trials. So the past year, there's been a lot of, as Liz said, a lot of focus, a lot of private sector. I mean, listen, there's even celebrities that are coming out and speaking about their stories and writing books and creating companies. I mean, Halle Berry, Naomi Watts, all of this is happening. There's investments, even specifically in women's sports, and just generally people are really cognizant, and people, and as Nada said, very cognizant at the corporate level. So there's nothing that holds anybody from a corporate level from saying, yeah, we're still including women in clinical trials. We're still including diverse populations. Like, this is who we are as a company. I mean, Medtronic, I just read the article this morning, saying this is what we do. This is how we develop products, and this is how we will continue to go forward. There's a lot of private companies that can still do that, private and public companies, and there's nothing holding anybody back from actually doing the right thing, whether it's mandated by, the FDA or by a regulatory body. It is the right thing to do. And I think a lot of people are cognizant now as a result of the past year and the past few years, a lot of us speaking out about it. So, while a lot has been reversing, we still have the ability to include women and to include diverse populations, regardless of what's written out or not. Like, this is a private sector that is allowed to do what they want. And, I think with the focus on it, it probably will be better for their business as well.
That's such an excellent point. And in the light that has been shined in the last few years, that's gotten beyond all of us on camera, beyond all of our audience, but just a much bigger picture. If I'm hearing what all of you are saying, there's some significant tailwinds that could carry us as these other changes are being made. And it starts with the individual voice, starts with the individual actions. That's really good to hear. We can't reference science without thinking about what has happened more recently with the cuts, right? So the administration has made cuts across FDA, across across NIH and beyond. So can we comment a bit on that, Netta? Would you like to just share what you know about what's taken place and what that impact might look like?
Yeah, I think it's just so unfortunate, right? I stem from FDA. I spent over 12 and a half years there. I say I grew up there. The people there are truly dedicated to their mission to protect and promote public health. They are public servants serving us as the public, making sure that products get to market, are safe and effective, and remain safe and effective once on the market. So it's really disheartening to see these cuts without any reason or rhyme, without managers actually being aware that their staff was going to be let go. And I'll speak to CDRH, Center for Devices and Radiological Health. The count of how many were let go is 229 folks, and that's about 10% of the center. And it disproportionately impact OPEC. That's the Office of Product Evaluation and Quality, and that's the pre-market. Those are the ones actually conducting the reviews. It's assumed that 50% of those are MEDUFA hired. They were hired to review the submissions industry puts in front of the agency. And many of them were brought in with special expertise that the center recognized they didn't have internally. So this was a way for us to get SMEs, subject matter experts, to improve the quality of our reviews and make sure we're doing the best job possible. So it's extremely disheartening. However, there is an opportunity still. They were laid off, but it's a 30-day administrative leave. So if this new administration can wake up to the consequences and the potential damage this could cause, it could be reversed, right? The hope is hopefully it will be reversed. I know that a lot of the medical device associations out there, MDMA, AdvaMed, are working hard to make sure that we can have the expertise in-house to continue the reviews. But if we don't, it is going to affect timelines, quality. And right now, we worked hard to actually bring in expertise into the agency. But even the morale or the message it sends is, do I really want to be working when I have no security or job security, that I could just be let go like that without any input from, no, this was no input from FDA and no input from HHS, right?
Yep. Can I just
Total
add to that?
blindside.
The impact is across it's across HHS. So I actually was just talking with ARPA-H folks, and many were told, like program managers leading major initiatives were let go on Friday. They got the letter that but luckily they were able to go back and argue, well, wait a second, ARPA-H, just like DARPA, it's all about, they say to operate like your hair is on fire. So everyone is term limited. They're out within a few years. So therefore, it doesn't fall into that classification of probationary. And just for the general public, that terminology probationary, all it means is that you got this position within 2 years or less. It doesn't mean you're a junior or you've done anything wrong. It's just words to describe that. And that's why they're just taking, as they call it, they were I'm blanking on the word, but a chainsaw to just like cut them all, as opposed to actually looking at what they do and their role. So interestingly, ARPA-H, a bunch of people did get that letter on Friday, but then it was rescinded, to Netta's point that with the 30 days, there's all kinds of things that could still happen, and there's ways that they can interpret and reinterpret. So that's where it is, at least for ARPA-H.
Yeah, it's cost cutting, similar to what you do in a manufacturing environment, frankly. That's kind of the approach that it's been interpreted by some individuals in the industry that have been sharing with me. Some of the concern with the population in that probationary period is often they're younger in career, and as we look at where med tech has been influenced in the last 5 years with new innovation, a lot of it is 68+% of the young companies that we have worked with and represented have some kind of digital back end or does some kind of digital service. And who understands that more than those that are young and newly minted from college and coming into the world that they grew up in and know so well? So we should expect delays. I mean, that's just a reality of this kind of situation, from both a situation where they're trying to figure out what's actually going to stick and what's not, but then big picture, and who's actually left to do the work. It's going to be a bit of a struggle to get there. Amanda, I'd love to hear from you because I know you're very close to AdvaMed. AdvaMed is one of the bigger entities representing a voice of medtech and speaks to efforts to elevate the industry overall. Where are they standing on what's taken place right now?
Well, the information I can share is that I've seen is on their website that they've put out publicly, and I know that Scott Whitaker, the head of AdvaMed, has written a letter to HHS to remind them that what we're doing is focusing on the science. It's focusing on patient outcomes. It's focusing on patients here in the U.S. And with the changes that have been made, this could potentially have the opposite effect of what they're trying to do with these cuts. I think we all know that there's inefficiencies that can be addressed, but we just want to make sure, and I'm speaking for myself now, that we're really looking at the impact on patients and innovation to help patients with outcomes, honestly, to drive a lot of efficiencies. Those are the problems that a lot of our customers in the hospital and healthcare settings are dealing with, is lack of efficiency. So I think just reminding and trying to demonstrate specifically the implications of some of these decisions is where we are right now. And what you're hearing here, I think, is we're all kind of learning. I think a lot of people are just connecting and talking to understand what the implications are and to understand how we can inform and work together to ensure that we're focusing on keeping the innovation here, staying, a leader in innovation, and ultimately taking care of patients around the globe.
Yes, exactly. And the impact to the broader medtech entity, which is what we're talking about, certainly feeds into what happens in women's health today and tomorrow. What are we expecting? Marissa, I mean, you're on the front lines here running two entities in the space. What have you seen? I'm curious on 2 points. I'm curious what you have seen around those tailwinds associated with the initiative and where we are response-wise post transition and into now, later into first quarter.
There was women's health innovation during the first administration, in the first term. There will continue to be innovation that happens in women's health in this administration too, and in this second term. There was a quiet women's health department that was working and helping to support women's health initiatives. It will continue this year. It's probably not going to be, we're not going to have, big parties at the White House, and we're not going to be celebrated and, things like that. And that's okay because we can do it ourselves. But I think what really is going to happen is there's still work that's going to get done. And I think that, listen, right now we're in this, we don't know what's happening, and, everything's being thrown at us very quickly and we're all responding. There also needs to be a settle time. We need to settle and we need to still do the work. Like all of us on the innovation side, myself included, in all of the companies that, that I speak to all the time, we're still doing the work. I mean, we're upset. We are being cautious. I've noticed that it's actually on the investment side, it goes two ways. Some people are really angry and they're just like, yeah, great, we're going to fund more. And then there's other people who are holding back. And so, listen, this is a change for everybody. And whether we had over 100 executive orders or we had one executive order, this is still a change. And so the innovation's still happening. And from everybody that I'm speaking to, it's still going on, and we're still doing the work, and we're still moving it forward. And we're going to move it forward as best we can. As far as, legislation and other work, we're still going to move it forward. That doesn't change. And so I think those are the things that, with the headwinds that we had now, probably with the tailwinds, we're going to innovate. We're going to have to think about where we get capital very differently. We're going to have to think about some of these larger programs, how they get funded. And I think this is also the time for the international community to step up, or other U.S. entities that are not the government to step up. The IFC, they have the ability to step up. They're not managed by the U.S. government. Partners like WEF on an international stage. And so this is where, like on these larger scale initiatives, and especially sometimes on the nonprofit and the global health side, like this is where the support can come from. I know that there's a lot of talk at some of the very large funding organizations to try to fill this gap. And, you know, nobody has had to. And so nobody's had the opportunity to really step up for it. I think also like this might just be maybe a rejiggering. This is a negotiation topic for seeing how much we could put in. And maybe we reduce our percentage and then everybody else starts to step in. And so I think I think we have to think about where do we go from here and continue on what we're doing. So I think I answered them both together, but
Mhm.
or tried. So, you know, and I think we kind of don't know, you know, and I can say from a small company and from other small companies that I speak to, and even large companies, we're still doing the work and we're still innovating and we're still, you know, getting things out to patients and customers. And so, you know, Amanda said it, like, this is still about patients and this is still about all of us. And that's like, we have to always continue to go back to it because whether it's going to be difficult to do, you know, certain things. Okay, great. But let's take the wins where we can get them and continue to move innovation because we're at this inflection point, and I think the last administration's push on it was able to kind of catalyze this, you know, oh, women's health is a thing in a greater scale. And people who didn't even know, like, you know, we're in our bubble and we get to talk about it all the time and it's always what we talk about. But when you go to the greater, you know, scheme and greater, larger audience, people don't necessarily see that. And so now people are hearing it. I mean, you know, you have celebrities on, you know, the morning talk shows and all of a sudden, you know, menopause is like, you know, you know, it's part of daily conversation now for everybody. You know, men are starting to even wake up to be like, oh, okay, well, yeah, this is a thing. And I think we're at this point where us as consumers, us as patients are demanding innovation. You can't put that genie back in the bottle. You really can't.
Something that is unique about our industry, which we've talked about for years, is the purpose, right? I think whether you're in a large company, a small company, government agency, the reason that we are all in this industry is because we care about what we do. It's not about a widget. It's not about a technology. It's about patients. And I have seen that for the 30 years that I've been in this industry. And, you know, the work that even you and I have spoken about at AdvaMed as we try to bring in the younger generation, right, to show them that healthcare, med tech is a space that is worth being in because it is so purpose driven. And that's where we're seeing these young people come in. So I think I've seen us over the years continue to work through different challenges because we care so much and because we can come together to create the change that we want to see. And so I think this is yet another change. You know, I mean, look at how we pulled together during COVID. Look at how we pulled together, you know, when we've been impacted by taxes in the past or other things that were going to hurt innovation. And I think this is another instance for us to come together as a community and figure out how we're going to move forward. At the end of the day, it's about patients, it's about outcomes, it's about, you know, helping everyone have access to living a healthy life. And I think we're all so passionate about it that we'll figure it out. And sometimes the frustration or the disappointment is what lights a fire, right? To keep us going. So I know that we'll figure it out. I know that it may have some short-term implications that are going to be disheartening. But at the same time, I think what is heartening is to see people stepping up, is to see people having open conversations with the goal of trying to figure this out and move forward. And so I know we'll do it again.
You know, Holly, this is not new. Like,
Mhm.
even when we talk about tariffs, I mean, you know, I used to be in contract manufacturing. You know, it was okay, here's China, here's Mexico, here's Costa Rica, here are all the other places, here are different places in the US, you know. This is not new. This industry is used to this.
Mhm.
I mean, everyone has contingency plans in place, especially in manufacturing and operations. And so, you know, they have alternates, you know, locations. Like, that's why alternate locations and multiple supply chains were created as a result of probably many years ago, the first tariffs that were put in place. And so this industry is prepped for it. We're going to fight against everything that we possibly can, but everyone's prepped for it. And there's always alternates that we can go to.
Well, the muscles have been strengthened over the years. There's a resiliency in the med tech industry that is very specific to med tech because of all of the reasons that have been mentioned. The other thing I want to make sure that we point front and center and continue to talk about is not only is it in the patient's best interest, and we all are either patients now or will be, but it's also good business sense. Okay, the markets that we're addressing, the products that we're bringing to market, they are good investments. They are very good investments. And as you mentioned, Marissa, it's a really great opportunity now to open up financial models that were not traditional, so to speak. I've seen that happen quite successfully in the other pockets within the medtech sector in the last 5 years, because COVID opened up gateways that we had no idea existed in terms of investment into the medtech sector. We've got channels that were unheard of 6, 7, 8 years ago. You never saw PE getting in as early as you do now. You never saw the global investment strategies, the partnerships, the privates of all kinds coming to the table. So it's making sure that although we're keeping patient front and center, as we all do, that we also keep front and center the ability for an investment to be a sound strategy. And that is what is going to, that's the intersection. It's what we care about and what we're investing in that ends up getting elevated. That's, no matter what clinical discipline you look at, that's where it's happened, at that intersection. And I know within women's health, it's an incredible business, and it also is one that we care about, and it's growing in care and concern, which is great, a great byproduct of the last few years.
I'm gonna steal one of Liz's phrases, but this is not charity. This is investment. This is business. Exactly what you said, Holly. Like, unless it's actually charity, but in general, this women's health is an investment opportunity. It's a business area to grow. It's one that was semi non-existent for a very long time. There's more and more money that's going into women's health investments, women's health research, women's health companies. The first few unicorns have been coming out and things like that. And as we have more and more investment, you have more proof cases and more more opportunities to continue to invest more. And so private sector is very angry right now. And so it's time to put the money where everyone's heart is. And we can make all this noise and we can talk about it all we want, but we have to move the money, and that means investment money. That means strategic, capital as well. That means investment in different business units, and diversifying and growing those businesses as well, and putting that money in, because exactly what you said, this is business. This is great for business. I mean, this helps all of us, and consumers are demanding it. You keep adding more money, there's trillions more that come back in economic returns. So this is literally a business sense, and I can quote tons of reports that are out there, but they're out there, and the work has been done, the research has been done, that when you invest in women and women's health, the economic returns are there. I think that one of the latest studies is, 300 million invested, there's a $13 billion return. Or every $1 invested, it generates $3 in economic return. This is just business. You don't have to be a woman, you don't have to care about women's health. This is an opportunity to actually grow the economy, which is actually what everyone's trying to do.
That's
Yeah,
right.
and Holly, the really important point and I just want to highlight that I guess I kind of take that for granted because I look around here and we're all pretty successful business people. You're one of the top recruiters in the industry. Marissa, you've got your own company that you've started with an incredible innovation. Liz, you've got your own company and you're bringing together really smart people all the time to drive business. Netta, you're incredibly knowledgeable and, bring FDA and regulatory perspective to all of these big companies and small companies that are trying to run a business. So I think sometimes when we talk about patients, because we do care, maybe it gets lost that we also are all leading business people that are trying to figure out how to fund these innovations, how to provide care to these patients, how to work with reimbursement. At the end of the day, I look around and we're all business people trying to run our businesses, support our families, and are making all of these decisions within that context. But doing right for people can be good business.
Yes, that's extremely well put, especially when we all are motivated by that. But at the end of the day, we all work for profit centers that have to have that kind of return in order to fuel and do more good work. That's the road that we're walking. You did bring up the tariffs. I thought it was pretty interesting because generally speaking, I've gotten fairly benign responses in the market to the tariffs. It's like, okay, yeah, well, we'll deal with this or we'll deal with that. Some are more, I was expecting a little more pushback. What's been your experience? And Marissa, because of your supply chain, I will ask about that. In your other CEO circles, how are people feeling about these potential tariffs and those relationships, and especially with ongoing with China?
It's funny, actually, I just had a coffee with somebody who does a lot of US China business. And he said, yeah, we've done this before. And things move. Same thing with Mexico. Okay, so then go to Costa Rica, or you go to Chile, you go somewhere else, you go back to Europe. Everyone's expanded quite dramatically, and so I've been semi out of that side of the business for a little while. But I mean, this is what everyone's always prepared for, and I think we understand it better. Listen, we're not talking about 20 years ago where we didn't even have Zoom, and we didn't have these technologies, and we weren't so, all these, electronic systems to understand where all our inventory was. It was not developed. And even 10 years ago, it's, everyone now knows, literally in what section of the ocean your boat is in. And in 32.4 minutes, it's going to arrive in port. I mean, these things are now thought of. And so, I don't have any examples, but I know that last time, several times that this has happened, and it's going to continue. There's ways, there's exclusions, there's exclusions for healthcare. There's always exclusions for medical devices, for pharma. So I think these things can get written in. Nothing's law yet. Nothing's 100%. And I think we have to understand that. We have to understand and mitigate the businesses. But I think, these ladies have a lot more experience in that, but I've seen it in the past. China gets tariffs. Okay. You switch it to Mexico. Great. You switch it to San Diego, just as close. You have redundancy in the business.
Seems like that makes sense. You have to have the plan, and with that particular, and this is my words, no one else's, but that seemed like the start of a negotiation. Throw those tariffs up, let's see where we end up, where it's much more defined when you have these major terminations of individuals. That seems more finite. We're going to lay off all these people, and here we are, and then we're going to deal with the pieces after the fact. So I am glad to see, and I want to remind the audience that there is still time for things to be changed there, and there may be some advocacy going on that does turn this, but as it stands right now, I know that there's been major changes and a lot of people impacted by that. So we will hold true to the importance of the science and the organization standing by and doing the right thing. What actions can we take to move forward? I know talking about it was one that we mentioned, but I'd love to hear, perhaps Liz, do you have ideas on what actions we can take? You're on the bleeding edge of this every day. What are your thoughts?
Yeah, I appreciate the question. I think it's so important to remember that your voice matters, and that whether you have a Democrat or Republican representing you in Washington, they need to hear how these executive orders, policy proposals, new reports, activities happening in committee, whatever the activity is, they need to know how it's impacting you as a constituent. And, Democrats may use that data in a floor speech or in a hearing to counter Republican speech or something. The Trump administration and a committee chair, they'll use it to help impact how they can tweak. So I think that right now, a lot of Republicans, because it's an all Republican controlled government right now, many are trying to figure out, okay, where do I work with Trump and maybe pull him back on some of these things, tweak other things? How do we do this? And so we're key to giving them that information to do that. And in fact, Senator Murkowski, who's a Republican senator from Alaska, was saying typically they would have 40 calls a day. It went up to 1,600 calls a day when that executive order came out stopping grants and the search for diversity, equity, and inclusion. The indirect cost being cut down to 15% also spurred huge outpouring, calling into senators and representative offices. Well, they heard us, right? They heard people calling in. So your voice really does make a difference. The other thing I'll say about that is how you deliver that message. It's really important to be politely disrupting, right? Politely sharing those stories, no flame throwing, no accusations, no insults, just provide the facts. Like this, a 15% cut down for indirect costs for grants. Right now we're at 40%. So let me tell you what that means. That means this equipment, that means the lights, this means nuclear medicine. Like just be very factual. And that's super, super important. And then what we are seeing during this recess week that they're home, they're doing these town halls and people are coming out and they're asking questions and they're demanding answers. Why these cuts? Why aren't you pushing back on diversity, equity, inclusion? This is how it's helped my business or my organization. That matters. That does have impact. And especially if it's in person, the member will not forget that. So just keep using your voice, politely disrupt, politely share that, and stay in front of them. And if there's any chance to be on like a task force or a work group with your member of Congress or with an agency, do it. Even if you don't agree with some things, that's still your chance to get a seat at the table to help shape things. So wherever you stand in politics, Democrat, Republican, doesn't matter. It's just what the science that you're doing, the leadership that you're providing in the district, that matters, and that needs to be shared.
Liz, do you have any scripts that people can reference, where they can go and get those scripts? Nada, was that your question too? Because I was going to ask you too, but Liz,
No.
is there a reference that you can, maybe we can put out later, Holly, to the audience?
Women's Health Advocates Group,
Yes.
womenshealthadvocates.org. We will be creating templates for folks to use, and we're going to have an all-in-one website where you can just go put in your zip code and then submit that way. So we are working on setting all that up. But yes, absolutely.
To provide you with like clear talking points as to what Liz was saying, I think we've basically, our hearts and minds have been stimulated in a very different way now. And we're all really engaged and committed 100% to wanting to see the positive change we desire, centering around patients, as you said, Amanda. And it is time to speak up and stand up. It's not time to be, hiding under your covers because it's just too much. And there's different ways to do it. I think there's a lot of times in advocacy and lobbying where you're trying to play the long game, right? And most parties won't come out openly and speak against their own party. But I'm sure there's a lot of Republicans in there who don't agree with what's happening. And they have to work behind closed doors and work their networks and work their ways to actually influence change. And I think that's where what we're saying within your own sphere, do that. One of our leaders from the Women's Health Advocacy Group this morning shared with us that there is a dean of a medical school who calls her representative every single day. Consistency matters. Persistence beats resistance is also what I've been told by folks. And she calls every single day. And we know that data is power, data is information. There are gaps in data, but data is what moves things, be it how folks are going to fund companies, or be it how we're going to reimburse on products and services for women. And we know there are gaps there. We don't have to recreate the wheel, but we're trying to fill those gaps. And to your point, Marissa, everyone's continuing to do the work. And it really is imperative that we provide meaningful information to providers in terms of how they continue to treat women and how we think about educating the next generation in the future to get over a lot of misinformation in healthcare that leads to poor outcomes. So it's driving behind this inclusive innovation that really meets the unique needs of the patients we're trying to get them to.
I think all of us in industry are also learning. So like I learn literally every single week from Liz, like there's work that we can do even on, not on the presidential level, on the House and the Congress level, and to get some bills through and things like that. So, breast cancer early detection, the Find It Early Act, like we're still working on that. And that still has bipartisan support. And that's what we still need to do. And listen, everybody from both parties, everybody gets breast cancer. Doesn't matter. It's not discriminatory. Precision medicine, that's really like where science is going. And that's actually a massive advancement where everybody wants to actually put money. So if we can push some of that forward. I mean, listen, the big Stargate, AI initiative that's out there for infrastructure. It's great. Wouldn't it be great if some of that was spent on women's health AI? And so I think we need to think about how do we tag into some of the initiatives and the focuses of what's happening and try to get the work done that we can get done. And maybe everything's not going to happen and we have to wait maybe 2 years, but let's do what we can now, because there are some areas that are bipartisan, always still have support, and we can still get done. And, working with the priorities of the administration and working with them to figure out how what we want also aligns. And maybe it wasn't thought of that way. And so, again, precision medicine, that's what everyone wants in healthcare. And that's where a lot of like the information was going. And that would make us a world leader in it. Well, great. That's the point of all of, a lot of these changes. And so, hey, we can be a leader in precision medicine by doing X, Y, and Z, and investment in AI in women's health. Great. Like maybe there's things that we can do that we can leverage. And I think we have to just think it through a little bit differently. But keep doing the work. And there are still so many things that we can get through. And maybe it's not dead. It's just not now.
It's so much of it is building blocks. So for example, since you mentioned Find It Early Act, 2 years, Find It Early Act only introduced in the House. We couldn't find a Republican senator. 2 years. But you know what? We found one. We now have he's a doctor in the Senate, Marshall, who co-sponsored with Klobuchar. So now we have bicameral, bipartisan bill that was introduced the end of last Congress. We're about to reintroduce it in this Congress. So every time we're building, building, building. So when it comes to advocacy and sharing your story and the work that you're doing, just remember there's a lot of repeat, building those relationships over time, and it does have impact. It's just never quick. It's a longer term impact. So I just wanted to mention that too.
Such a good point. And I love the idea and the visual of building blocks, because if we really think about it, and it's bipartisan, it's what our country's made of. We are made of the ability to talk and speak and voice what we want. And let's really give insight to the audience, knowing that most of them, because we do have an elected president, right? Most of them have voted this. So this is not a Democrat, this is definitely a bipartisan issue to be able to voice what matters for your business. CEOs of young companies in innovative circles are concerned right now. So how can we equip them with the right voices? And I love the idea of providing them some language and some potential follow-up materials that will link to this discussion that may offer some additional actions that they can take. Because this has nothing to do with, we all have the same goal. We want to be a prosperous nation. We all have the same goal. We want to be on the forefront in medical care. Those are things that I hope we'd have 100% hands raised for, right? So let's go back to those blocks and start creating those avenues. And I think there's a lot of individuals, myself included, that are a little lost on how to get there with everything going on in the news. So the more that we can equip our audience and those that really care about this space with actions that can be taken, be very, very helpful. We appreciate that.
I think I'll speak from an FDA regulatory perspective. If you have been impacted where you've lost lead reviewers suddenly, and this is the reality, if we get down to the grassroots level, a lot of folks will let go. 10% is not insignificant of a pretty small center already, but doing immense amount of work. I remind people, you can go to see your clinician and never get prescribed any kind of pharmaceutical or biologic, right? But you'll always come into contact with a medical device. And people need to recognize the impact and the potential of medical devices to really alter care here and have an immediate positive change in quality of life, et cetera. Not that I'm diminishing the pharmaceutical biotech space, right? But this center took a huge brunt to its workforce and its morale. So I think if you have lost lead reviewers, the transfer of knowledge even wasn't allowed, right? This is definitely going to impact timelines and potentially quality, right? And I recommend people be patient, but also take those real examples to the MDMA, to the AdvaMed, because as we keep talking, stories are power. data is, and sometimes it's anecdotal, but it's only anecdotal if it's one or two. But if we start to have this collective information, then the folks advocating and lobbying on your behalf can put that in front of them. And let me also speak to FDA themselves. I know they're working hard inside, but sometimes their hands are tied. But I know they're not just sitting. The leadership there is really trying to advocate to get their staff back, to make sure they have the resources so that they can serve their mission, promote and protect. But this may cause them to have to prioritize what they focus on. And it's those high-risk products. I anticipate eventually pre-subs, which was a beautiful thing. It's a way FDA can give you free consulting, right? In the past, some people say come often. I don't agree with that because FDA is busy. You might not even get any now. So you got to be thinking long term. What are the downstream impacts? And they're real. And I don't want to forget the people. People's lives have been impacted. We talk about the people. It's who's doing the work, who is in service. I'm going to quote Dr. King here because it is Black History Month. And I think it is a relevant time. If I always say, if you're in healthcare, you're in it for service. But he even said, like, how can we serve? And everybody can be great because everybody can serve. And we can all have an influence within our sphere. So everybody can be great and we are all great, but we have to serve others as well. So I do think it's collecting the information. Sorry if I went all around, but collect those real examples of how you've been impacted and share those with folks who have a voice. They can elevate your concerns. They may not be the experts. I think we heard this, Amanda. Maybe you can speak to it. Jane Fonda at the Women's California conference. She talked, you know, as folks in high-level positions or can amplify your voices. So just share their information to really impact change.
I have one other thing I'd love to add in. So MDUFA for medical device user fees, that legislation is up in September. So they will need to negotiate that. And so another example where you could insert your voice, we know that Secretary Kennedy feels very strongly about divorcing industry from HHS and FDA. And so like many people don't even realize that user fees pay for half of all the expenditures. So we do need to do some education of the new leadership of HHS to make sure they understand why user fees work. If we eliminate all user fees, we are going to cut innovation significantly. So that's another place I think for this industry to exert our voice.
Yeah, I was talking with a portfolio company yesterday or the day before, and you know, some of the implications are some companies aren't going to be able to afford to wait here in the US to work through the regulatory pathway, and so they're making plans to head to Europe. So I think we could see a direct flow of innovation that can help patients here in the US and generate business here in the US move outside of the US due to the inability to get through the regulatory process and get to patients. And there's a lot of implications that just seem like they might not be aware will have the opposite result of what's intended here.
That reminds me of what happened with Europe and Brexit and everything. It just really caused so many changes and so much delay. Great information, all of you. Is there anything that we haven't covered that you'd like to make sure we do?
I think it's been a great discussion. I think we've covered a lot of topics. My passion is always advocacy, so I would love to close out with the reminder that your voice matters and that you do need to talk to your members of Congress about all of these issues, anything impacting you that has been done or like MDUFA could come up in the future. So just make sure you're using your voice and you stay engaged. It really does make a difference.
Thank you. And we will look forward to additional information that we will link to this particular discussion. So thanks for that, Liz. Marissa, anything in closing that we haven't covered you'd like to make sure you share?
No, I'm just going to reinforce that we have to keep going. We have to keep innovating. We have to keep moving forward. And we're going to. We're going to anyway. And I think one of the things that's really important right now is for all of us to do it together. and we have to get out of our silos after, away from our individualism and even individual companies. This is the time for bigger companies to really step in and support smaller companies. This is the time for the investors that are not used to being in women's health to be, in women's health. And it's for a place for all of us to use our voices to get everything done. And we have the power to do it. We know that we can do it. It's literally not a question. It's just all of us now have to keep working together even more. It's less about the individual, whether it's the individual person or the individual company. And it's about moving literally our entire sector forward and innovations forward, whoever created them. And so I think we just have to keep going keep going. Like, that's the phrase in the UK, keep going, move on, something like that. I know it's not right, something about the Queen. Keep calm and move on. That's what it is. So I think it's hard to stay calm right now. It really is. I'm not calm, but we have to keep going, and things change. One administration is not going to take down an entire industry.
Yes, well said. Amanda, anything you'd like to add?
Well, I'd just like to thank you for continuing this conversation. It is going to be a journey, and I do believe that collectively educating ourselves, creating forums like this where we can share facts and come together to determine how to work forward is what's always driven change and what will continue to drive change. So let's stick together. Let's look at the facts and let's understand how we can work with those to continue moving forward. I have no doubt that we will. It may look different than we thought, but I have no doubt that people care about these issues from a patient perspective, from a business perspective, and that we'll figure out how to navigate and keep going. So just stick together.
100%. I mean, this was an idea, and within 24 hours had all of your attention and all of your commitment. I mean, that's a testimony, because I know each of you are insanely busy with very big jobs, and it's so appreciated. Netta, lastly, any comments, anything you'd like to share?
Well, first of all, I want to thank you, Holly, because you're really speaking into what we've all said, walk the walk, you don't just talk the talk, right? And to make change, you have to do it together. And I think that's what hopefully the audience will take from this, right? I do want to thank people in federal government for their science first and their service. So that really is critical. And we heard a lot about it, but to do it together means coming together. It's meeting face to face. And I think we need to possibly listen more than speak. Try to understand someone else's perspective. They say, walk in someone's shoes for one day to really see what they're going through. And we need to unify and overcome the differences. Liz said it. We're here. Let's deal with what we have to deal with right now, right? Regardless of the differences. And we know different perspectives allow for better problem solving, and we got a lot of problems to solve. And we can also look at them as opportunities to grow. And there is immense appetite for investment in women's health, in developing products that really meet women's needs across their lifespan. And like you all said, and the data's there, the ROI, i.e., your return on investment in effort and money has already been proven. We don't need to say it again. So again, thank you, Holly, for leading the charge with us all, and always love getting together with this team and just chatting.
Well, we'll definitely have to have a follow-up later this year and discuss it again. But for now, I would encourage our audience to keep track of all four of these very prominent speakers on behalf of women's initiatives overall, as well as on the medtech sector overall. So if you're not following them on LinkedIn, definitely do. There's a lot of good information that will continue to come out, and see what's going on there from the streets. Look, we still live in the best country in the world, and I wouldn't change it for anything. Even with our challenges and struggles, it's always made us stronger before. We can get through this, and we can continue to push. Just by every one of your smiles and strength to continue to fight every day, I know we can as a country as well. So again, very thankful and grateful for each of your time, as well as the audience listening here. Thank you for joining us today at 160 Studios, and be well.